Thank you for joining us for Health Talks. I'm Gail Hogan, an emergency medicine expert. Dr. Luca Delatorre is here to tell us about the unique expertise found at Ohio State's Advanced Urgent Care. Welcome, Doctor.
Thank you. Thanks for having me.
What is the difference between advanced urgent care and urgent care?
One of the most important things that we recognize is that having an emergency medicine physician, so a board-certified emergency medicine physician, is really important to provide the best level of care at an urgent care. And that's why Ohio State's Advanced Urgent Care kind of differentiates itself. The other thing that's really big is that we have a great access to diagnostic imaging that most urgent cares don't have.
So this is different than your average walk-in urgent care.
Without question.
Besides the diagnostics, what other kind of expertise do you have that patients can expect?
The important thing is we have access to all of Ohio State's excellent physicians, right? We have a health system that's nationally ranked and #1 in Central Ohio. So we have access to all of those resources after someone is seen to get them into the best possible care.
What kind of conditions do you treat?
All kinds of conditions that a typical urgent care would see, but also things that some people might consider more serious. We see lots of orthopedic and sports-related injuries. This time of year we see lots of cough and cold injuries, sore throats, but we can see something as scary as a pneumonia for a patient because we have the ability to take care of that with both x-rays and potential for IV antibiotics if necessary prior to sending someone home.
You mentioned x-rays and other diagnostics. Can you expand on that a little bit?
Absolutely. So most places will have access to an EKG or to check on someone's heart, x-rays to check for broken bones, but we also have the ability to do CAT scans and ultrasounds and even a bedside ultrasound that our physicians have to do an ultrasound right at the bedside with the patient.
You mentioned access to doctors at Ohio State. What other kind of expertise, what other kind of nurse practitioners are available for patients at Advanced Urgent Care?
Yeah, so all of our providers are essentially trained in emergency medicine. So even our APPs, advanced practice providers, which are nurse practitioners or physician's assistants, are all familiar with emergency medicine. And that goes down even through our nurses and our techs. Everyone's familiar with emergency medicine. So it's really built a good teamwork to make the best patient care possible.
For patients, though, they may not know the difference between advanced urgent care and the emergency department, or when should I go to where? Can you help with that?
Absolutely. We actually have a call line for Ohio State where patients can actually call their doctor and see what would be the best place to go. One of the things that's important, if there's a likelihood that someone needs to be admitted to the hospital, they might need to go to the emergency room. But we can take care of lots of things that would surprise people. People that need IV fluids or dehydrated, people with abdominal pain, nausea, vomiting, things like that, because we have the ability to give IV medicines at Ohio State's Advanced Urgent Care that a lot of places don't.
What if someone then does need that follow-up care?
Absolutely. We have excellent follow-up. We have case managers embedded in our system that work with us, so they actually are able to integrate patients right into the system, sometimes even the same day.
Do you have many locations in Central Ohio?
So right now we have 4 locations. We have Dublin and New Albany. There's also a long-standing relationship with East Hospital and then Martha Morehouse.
Are there times that are different than a regular emergency department?
Yeah, so most emergency departments, or all emergency departments, are open 24 hours a day. We're open until 9:30 p.m. And weekends we're open from 10 a.m. until 9:30 p.m. To provide a great care where our patients live.
And I understand you can make an appointment, so it's not just if you have an emergency, you can call ahead.
Yeah, we actually think that's really important. So we want to maintain the ability to have a walk-in, because a walk-in advanced urgent care is a great idea. But for some people that might not be able to make it at a certain time, or they want to reserve an appointment, it's really important to give them an opportunity to show up when it fits their lifestyle.
This is a new concept, isn't it, this advanced urgent care?
Correct, yes.
And Ohio State, obviously, is on the cutting edge of that. Why is this important as opposed to just to patients, than just a regular urgent care?
I think it benefits all the people involved, right? So it benefits, obviously, our patients because we're meeting them where they live. Historically, to come downtown might be intimidating to some patients. If you're not feeling well, driving in a car down 315 may not be the best thing. But if you live in Dublin or New Albany and it's an easier trip, that's great. We also know that decompressing the healthcare system is really important. Columbus is not getting smaller, and so we want to give people access to the great care we have at Ohio State, and this is one of the ways that we've envisioned that.
Great.
Yeah.
Thank you very much, Doctor.
Yeah.
And thank you for joining us for Health Talks.